Hello and welcome back to my channel. My name is Rashida or Dr. Rashida, and today I have something really interesting that I want to talk to you guys about. Have you guys ever heard of a sleep disorder where you do sexual behaviors and things and then have no recollection of it? So if you're interested on hearing more about sexsomnia, stay tuned. This condition is called sexsomnia, and it's a real condition that you can see in sleep medicine. I had never heard of this before. And as I was going through my readings, my homework assignments for work, I came across it in the reading and I was blown away. So I just wanted to share this. I want to share interesting things that I'm learning, that I'm seeing in sleep medicine that you could come across that I think are very interesting. So let's talk about it. Sexsomnia is considered to be what is called a parasomnia. And what a parasomnia is just an abnormal behavior that occurs while someone is asleep. It falls under non-REM parasomnias. And what that means is it happens when the brain partially wakes up from a deep sleep. And during these episodes, a person may have sexual vocalizations, masturbation. They can try to have intercourse with a partner or someone else. And the thing about it is they don't even have any recollection of this. How is this different from, let's say, sleepwalking? So they are both considered to be parasomnias, and they both kind of arouse the same part of the brain. However, they differ because sleepwalking, of course, as the name states, you're going to be walking, you may be moving objects, you may be doing certain things like that, whereas sexsomnia involves sexual behaviors during sleep. There's another disorder called REM sleep disorder where people act out their dreams. You may have heard of this, where people are having like these violent dreams, and normally during the REM cycle, that's when you're in a deep sleep and you have the fast eye movement, your muscles are supposed to be laxed. And so in REM sleep disorder, your muscles are really toned and you are able to like fight and act out your dreams. So this also is different from sexsomnia as well. Common triggers include sleep deprivation, alcohol, sedatives, irregular sleep cycles, stress, alcohol use. Additionally, sexsomnia is also associated with other sleep disorders like obstructive sleep apnea, restless leg syndrome, periodic limb movement disorder. These conditions all can cause fragment in sleep and can trigger parasomnias. Evaluation usually includes a detailed sleep history. Because the patient has no recollection of what happened, usually the bed partner is a very good source of telling what happened, what the patient is doing throughout the night. The patient also is going to be evaluated for other underlying sleep disorders, as I mentioned before, which other sleep disorders can trigger this. And in some cases, an overnight sleep study may be performed to capture video of the patient. The treatment is going to focus on reducing triggers, as we mentioned before, with the stress, alcohol, certain sedatives, undiagnosed sleep disorder. And some patients may require medication, or there may need to be an adjustment to their sleep environment. Sexsomnia is actually a real sleep disorder, and the behaviors happen during a partial arousal from a deep sleep. And this is why individuals typically don't have any recollection of what happened. So if you or someone you know is experiencing this, it is best to get evaluated from a sleep specialist to get you the best treatment. I think that a lot of disorders that people haven't heard about, I think there needs to be more awareness so that when people are at their primary care doctors or their other specialty areas, then if other providers are aware that these are actual diagnoses, then patients can get the help that they need. And a lot of people, I think, who's heard of sexsomnia? Can you imagine going to your primary care doctor and telling them I'm doing these sexual things to my partner, doing sexual things to myself, and I'm waking up and I have no idea what's going on. People will look at you like you're crazy. So I want to give a voice to those people, to various different sleep disorders that people may not know about, and just let you guys know there's a lot of things out there. Sleep is so interesting. Don't sleep on sleep. Do not sleep on sleep medicine because it is very interesting. If you are interested in learning more about different types of sleep disorders and what's it like being a nurse practitioner working in sleep medicine, definitely subscribe to my channel. Definitely comment down below what topics and what things you would like me to talk about in more depth, and I will be happy to do so. So once again, thank you for watching, and I'll see you next time.